School of Pharmacy at the University of Kentucky in Lexington, one of the top pharmacy schools in our country. And as we talked about at the beginning of the show, one of the areas where we are seeing a growing need and more job opportunities across the board is in health services, health care. We learned about the need for nurses, particularly during the Miami leg of our 30 Million Jobs tour.
In 3 to 5 years, as the boomers start retiring, then we're going to see that we really must galvanize more people into nursing. The average age of a registered nurse is almost 50. Probably a third of the current nursing workforce will be vacated as soon as the boomers retire.
The workload is stressful, and you feel the need for more staff, more nurses.
If you are willing to maybe travel 30 minutes away from your home, they're probably snapped up in about 2 weeks, if that.
And it's not just nursing. Listen up, parents and students. The healthcare and social assistance sector expected to gain the most jobs in America of any group between now and 2020. But our next guest says that healthcare jobs alone, and the demand may be there, will not cure America's jobs problem. In fact, he says, without more real jobs, specifically in manufacturing, in industry, in a truly vital and prosperous economy, that those healthcare jobs simply will not do the job. Joining us now from Charlotte, North Carolina is Dr. Stephen Greer, CEO of the Healthcare Channel and a healthcare sector financial analyst, and he also is a trained surgeon. So the man knows of what he speaks. Doctor, walk us through your lodge. So we went through this, and I know we talked about this in the pre-interview. You don't dispute the opportunity to create work and health, but you do argue that if we do not get a bigger brain about what it means to have a prosperous nation, we're going to need a lot more than healthcare jobs.
Well, yes, since the financial collapse last 5 years or so, healthcare has been one of the few sectors that's growing jobs, but it's a bit like the tail wagging the dog. That can't be sustained because healthcare and all of those jobs are really paid for primarily by the private sector as opposed to Medicare and Medicaid, and that requires insurance via employed people. So as unemployment has skyrocketed, the fewer insured has pushed the care into the lower paying Medicaid and Medicare. And that's having a real hit on medical centers. And as we speak right now, the 2012 budgets for most medical centers are being formed, and there's 10% or more cuts being made. So for the first time, and this isn't well appreciated by anyone, and maybe a first on your show, is for the first time we're seeing layoffs in medical centers, even at the doctor level, which used to be, it's thought to be a rock solid job. So the healthcare sector can't continue to grow unless the overall economy and jobs improves.
And how direct is the correlation between the fact that our healthcare system right now is tied to employment? In other words, we have employer-based healthcare. If you don't have a job, you're not paying. You're not really frequently not participating in the American healthcare. In other words, if American healthcare wasn't employer-based, would it change what you're saying?
Oh, well, sure. If it wasn't employer-based, it would be a completely different market. But right now, almost all private insurance is tied to a job. So, and conversely, where we're seeing some improvement in Detroit with the automobile industry picking up, I did some field checks and some doctors, some friends I know up there who are senior CEOs and so forth. Surprisingly, the Detroit hospitals are actually seeing some improvement, tying in with the improvement of the Detroit economy, whereas in other areas, most other areas of the country, the medical centers are having deficits. So yeah, it's if you eliminated that employment sector tied health insurance, that would change things. That all goes back to World War II, post-World War II. It's a whole separate topic we can talk about if you like.
Yeah, no, it's one that I've talked about at length, just because it drives me nuts, because I really believe that in order for people to seize the experimental culture that we need, especially with the students at a college like this, there are so many people in jobs that they would love to go try an experiment, but because their health care is tied to whatever their job is, they're prevented from seizing the experiment that is at hand. That's got a litany of problems. But let's not go too deep into it. I want to talk about something that you brought up, which is that one of the bigger growth areas for healthcare in general, regardless of what the system is actually going into patients' homes. Can you elaborate on that a little bit?
Sure. If you break down healthcare, an astonishing amount is spent. Not many people realize we spend more on healthcare than the military. It's now surpassed the military budget. We spend 2.7 trillion with a T on healthcare. Now, if you break that down, the inpatient hospital expenses are still the biggest, but the move to treat outpatient care and home nursing and so forth is growing. And as the aging population grows, Alzheimer's, diabetes care, it's just going to grow. So I believe one of the, other than flat out fraud as being a growth, which I'll get to in a second, the home care sector is one of the growing sectors within healthcare.
What are your thoughts? Because we were just flashing the statistics on the costs on those who are working out there, who, like Dr. Jeffrey Brenner, who we've talked about it at length, we were talking about it at length in the book, who is hotspotting effectively, finding in his case the 1% in Camden, New Jersey, that are responsible for 30% of the healthcare costs. You know, the 5% of the American population is 50% of the healthcare costs, and making those people healthy as a goal, which is sort of not how we function right now.
Yeah, well, there's a huge demand for any sort of industry, service, or technology that reduces medical error, reduces hot spots, gives better quality of care, as opposed to the old model, which is trying to sell a drug or trying to sell a medical device or trying to sell something like that. There's this new service industry or technology industry of trying to find new ways to deliver healthcare better, more efficiently, and reduce hospital errors. I'm working with Johns Hopkins with Peter Pronovost on his checklist system, and there's just a tremendous need for that, yes.
And how valuable do you see that? And also, from talking to Dr. Brenner, that sort of thing that you're talking about is very threatening to a lot of incumbent businesses who stand to lose a revenue stream as we adopt some of these new techniques. How much of an issue is that?
Yep. Well, that's a good point. Dr. Berwick, who used to run CMS until recently, said up to 30% of healthcare is fraud or unnecessary therapy. Well, that fraud to you is someone else's income. So if you think about that, we'll suddenly be cut down on hundreds of billions of dollars. That's someone's illegitimate income. And so there's pushback, lobbyists, absolutely. It's not going to be easy, and that's the reason our completely broken Washington has not been able to address this whatsoever.
Ultimately, when I talk to folks, I was with a bunch of folks earlier today in Lexington. We've been traveling all over the country. I encourage them to look to those who are actually succeeding in specific hospitals with specific practices, and then look to their local hospitals. In other words, I agree with you on Washington. It seems that it's only if we look at the actual hospitals in our own communities, here in Lexington, back in New York, wherever it is, and actually apply some of these techniques that we all talk about in specific hospitals, that we can even stand a chance to do some of this. Do you agree with that assessment?
Well, the key, when you look at model centers, Mayo Clinic, or places like that, it's really more of a lump sum bundled payment as opposed to fee-for-service. So when you go to hospitals that make money by doing more and more tests and doing unnecessary tests at the end of life and so forth, the Dartmouth Atlas tracks that. We know who the bad offenders are. They're in the big cities. You go to the Midwest, Ohio State, UK, Mayo Clinic, and then you get places that are delivering higher quality of care for much less cost. And those are the future. I think Medicare is going to be changing. They're going to be starting to do more bundled payment and getting away from fee-for-service. So the future is also accountable care, or ACOs. That's something part of quote-unquote Obamacare. There's a lot of things going on in Medicare as we speak that's going to try to get away from fee-for-service. Right. If you could get away from fee-for-service, you could solve the problem.
Yeah,
try telling them that too.
Yeah. Rings loud and clear, Doctor. Listen, the music to our ears, and you certainly have an ally with us in your advocacy around reforming fee-for-service such that we can get doctors and patients into an aligned interest structure as opposed to some of the misaligned interests that we see in too many parts of our society beyond healthcare. Thank you, Dr. Greer. Appreciate it. Stephen Greer, the boss at the Healthcare Channel. If you're lucky, maybe he'll conduct a little surgery on you, although you would be unlucky in that context because you'd be having surgery, but you get my point. Anyway.